The pills that help hundreds of thousands of people living with HIV are free in Kenya. But for those living with the virus in Lamu, there is a different cost.
That's right. As we continue to tell the stories of Kenya's HIV journey to 40 years later, we look at the paradox that haunts parents and patients and overwhelms the healthcare system in Lamu County, where a lack of budgets to support community interventions transforms free medicine into an expensive luxury. Take a listen.
Kwa kipindi cha miezi kama miwili zimekuwa na shida. Sababu kitu ya kwanza, mahali tunatoka huwa ni mbali. Kitambo kuna wakati tulikuwa tunaletewa madawa pale nyumbani kwa support group. Tunaletewa dawa hapo, tunachukua hapo. Sasa saa hii kipindi ya miezi kama miwili hivi, mitatu, kuna shida sababu lazima ufuatie hapa na ni mbali. Hivyo unafuatia, umekuja miguu, utarudi miguu. Nyumbani hivyo maisha yamekuwa magumu. Pengine huna chakula. Na ile dawa huwezi ukameza ukiwa huna kitu ya kukula. Kwa hivyo saa zingine huwa mtu anaruka.
It's been 2 months that she skipped her HIV medication. She's fully aware of the implications. Hers is a case of a spirit that is willing but body won't let her.
Kama tunaweza letewa dawa kule mashinani, hiyo ni kitu kimoja. Inaweza fanya maisha iendelee. Kitu ingine, kama naweza pata mtu wa kunisupport na chakula tu, hiyo hata nayo inafanya maisha iendelee.
She knows that it is possible to get the kind of support she's asking for because once upon a time she had it.
Pale Kenyatta tulikuwa tukienda tunapewa transport. Na siku hiyo tumeenda tulikuwa tunapewa kitu ya kukula siku hiyo. Lakini huku hata ukikuja hakunanga kitu. Hakuna transport, hakuna nini.
Others living with HIV in Lamu County can relate to her struggle.
My name is Daniel Kimani, married to one wife and blessed with 5 children. I live in HIV status and I've been in the same for the last 29 years. My wife, the same, is HIV positive, but the 5 children are all negative. Currently, we do not have any support from any organization, no donors in this county. I remember some years back we had an organization known as WICODEP. They really used to support PLHIVs. I was trained under WICODEP. And again, they have been supporting us, but today they don't. They do no longer exist. Again, we also had peer champions who were also trained and supported by the same organization. These peer champions were doing what we call defaulter tracing. But today, a bigger number has also gone back to that. They have defaulted. The first 1 or 2 months, they really tried to work without support, but it also became difficult.
40 years later, counties like Lamu are still struggling with community outreach program. And the struggle may take a while as financing for such program dwindles. Hard is what Lamu County is accustomed to when it comes to financing its HIV programs. It's not for lack of trying though. The county gets the least budget allocation from the Exchequer. This is based on its population of about 150,000.
The effect is lack of robust screening, testing and preventive programs. So you find that the little money allocated tends mostly to go to the facility-based intervention. HIV is basically a community disease. For you to actually intervene, you need more of community-based interventions and programs to target specifically outreaches. People are more comfortable accessing testing and counseling services in the form of outreaches rather than facility-based, for the obvious reason of stigma. We feel that this is quite a huge lost opportunity. The fact that we are not able to do community-based interventions on matters HIV and AIDS.
Unfortunately, we do not have anybody to support us in terms of the logistics. Majority of the community do not even know the existence of the PrEP.
Those living with HIV carry this burden silently. But why does Lamu County not get the support for its HIV programs similar to other counties?
They say prevalence rate of 2.2% is low, which to them does not warrant much intervention. However, we were at 1.5% just 2 years ago in terms of prevalence. So there is that increase in terms of prevalence, and I would mostly attribute it to one is new infections. Because of that lack of awareness and community-based interventions. The level of defaulters will definitely go high, and not just for HIV, but infections or opportunistic infections that go hand in hand with HIV, including, for example, TB, for which we have a defaulter rate of about 2%.
While bureaucrats shuffle statistics, in Lamu, HIV care isn't about percentages, it's about survival. Every delayed boat ride to the clinic is another day someone's parent, child or neighbor fights to stay alive.
As people have started defaulting, unfortunately we lost one of our kids last month who passed away due to that because the lack of support. You know, when he's coming, he needs the support. We also tried, but we could not do it further.
We were supported by a sub-recipient through Global Fund, helping us with PMCTC issues and defaulter tracing. But since the funding, the Global Fund ended June this year, so that one has also gone. So we are left with none. We are struggling, supported by the county only.
Lamu County is moving forward the best way it knows how. Here, the fight against HIV isn't just about medicine. It's about ingenuity, compassion, and the relentless pursuit of hope in the face of adversity, even with limited budgets.